You're watching the station that works for you. Good Morning Maryland at 9.
And welcome back on this Wednesday morning. It is February the 16th. You've already seen the video by now, and people still wondering what happened. A Los Angeles television reporter delivered a live report from the Grammys Sunday night in L.A., but it's her slurred speech that has millions wondering if, in fact, she suffered a stroke. Live on the air. Take a look.
A very, very heavy rotation tonight. We had a very Darrison bite. Let's go to Terry's and look for the head of the pit. We had a very Darrison.
It is so hard to watch. Serene Branson could barely be understood during her report, and obviously she could not be understood. Speculation has centered that it was a possible stroke or seizure. Live on the air. None of this has been confirmed yet, but people still wanting to know what exactly happened to Branson. Could be something referred to as aphasia. That's a neurological condition when people are having trouble simply expressing their words. In this morning to explain this is Dr. Kevin Scruggs with Good Samaritan Hospital. Doctor, thanks for the time today.
Thanks, Joe.
Now, you have seen this played out several times, and it's so hard to watch because you can clearly see by the reported expression she knows something's wrong. So she's thinking and she's hearing what's coming out of her mouth.
That's right. The concerning part is that you can tell that she knows what she wants to say. However, the connections in the brain that allow you to express what you want to say are obviously disrupted, at least on a temporary basis.
A lot of people may be thinking in terms of live television sometimes, trying just to simply find a word. And at that point, you can get tongue-tied. Trust us, if you watch this show enough, we all do it, especially this guy. This was something, though, much more serious, wasn't it?
Right. It could be, well, obviously it could be symptoms of a stroke. Although she is a young person, strokes affect all age groups.
Toward that, though, it's something that is becoming more apparent, and this is something where younger people are more at risk. We're now learning this as a result of what Serene Branson's experience was.
That's right. It's a national problem, and there's been a lot of awareness, heightened awareness about strokes and mini strokes and the warning signs of a stroke.
Before we get to the tips of what people need to look out for in terms of strokes, what is aphasia? Again, one more time.
Aphasia is the disruption of the ability to express what your brain is telling you what you want to say. So although the parts of the brain that process your words are there, the ability to actually speak is disrupted.
Is it disrupted due to a lack of oxygen? Is it a synapses malfunction? Is it just an overall malfunction in the connection of the brain to the mouth?
Now, the thinking is that there's a disruption in the blood flow to that part of the brain that controls the speech. And if that part is disrupted even temporarily, then it doesn't take long for the brain to stop functioning.
Now, some others are speculating it could possibly be a seizure, something that might not be as serious as a stroke, but still something you don't want to ignore.
That's right. That's right. There's other possibilities, complex migraine headaches, seizures, that can also, they're difficult to assess, but they all are possibilities.
Now, as younger people are certainly susceptible to stroke, this is something we need to be aware of, some telltale signs we might want to look out for.
Well, the symptoms and signs of a stroke can be very subtle. It can be just dizziness, blurred vision that could be transient, to the more obvious and dramatic, like facial droops and paralysis on one side of the body.
Hey, if we have time real quick, let's throw that video up one more time, because if we can see that, you were talking about the facial droop, that seems to be one of the more common things that you see when someone's experiencing a stroke. It doesn't appear in this. As we take a look at this, there's no facial malfunction here. Would that be something you would look at and say, okay, probably not a stroke, but again, you're not her doctor, so you can't say specifically?
No, just without the facial droop, it doesn't necessarily mean that she didn't have a stroke. But you can see that clearly her speech is disrupted. So really the center of the brain that controls speech is really the area that this is affecting.
And one thing that may be overlooked in this, because this is receiving so much attention, this could actually help people down the road to be more aware, couldn't it?
Well, you think on a nationally publicized event like this, yes, you want to take advantage of this to educate the public for the signs and symptoms of a stroke, and really to get to their doctor, or get to the emergency room as quickly as possible.
All right, Dr. Kevin Scruggs, thank you so much for the time. We'll have this on our website, abc2news.com, a little bit later this morning, and you can check it out if you missed any part of the interview. Time now, though, for your 2 cents, and for that, we say good morning again to Megan.
All right.